Hi, I'm Dr. Marty Willmitch, and I want to welcome you to the Peripheral Neuropathy section of our website. Before we talk about peripheral neuropathy, I want to just explain to you and make the statement that peripheral neuropathy is a horrible disease. It is a debilitating condition that will rob you of your quality of life. The good news is that peripheral neuropathy is treatable. Okay, it's fixable in 96% of the patients. Let me say that again because a lot of you have been told otherwise. A lot of you have been told that you have to learn to live with it, and that's entirely false. 96% of the people suffering with peripheral neuropathy are treatable. They're fixable. Okay, and I'm going to explain a little bit about that today. Now, the first thing I want you to understand is that peripheral neuropathy is due to a breakdown in our nervous system, predominantly the nerves in our legs and feet. Okay? Now, our nervous systems don't just break down for any reason. Okay? Something causes the nerves to break down, and that's ultimately at the cause of peripheral neuropathy. Now, I know that a lot of the times, a lot of the patients that have come to us have told me that they've been diagnosed with peripheral neuropathy and they've tried this medication, they've tried that medication, things like Lyrica or Neurontin or gabapentin, and that they've been on these medications for years and that they actually don't feel any improvement with the medications, or at best, some of them will report that the Lyrica or the Neurontin will give them a little bit of a break. It just takes the edge off the pain. And like I said before, that's the majority of the patients that we treat. Now, when that happens, typically patients are then going to be put on a pain medication. Okay? And the pain medications are not meant to fix anything. All they're meant to do is just take some of the edge off the pain, make it a little bit more comfortable for that patient. And I'm here again to tell you that neuropathy is treatable in almost all of the cases out there. 96% of the time, we can fix neuropathy. The trick to treating neuropathy is actually figuring out what's causing the nerves in the legs and the feet, even sometimes the nerves in the hands and fingers. Something is causing those nerves to break down. When they break down, that's when we start to get the symptoms and the sensations associated with peripheral neuropathy. Things like tingling, pins and needles, burning, shooting, stabbing pains in the feet and legs, ultimately even numbness. And I've seen people that have actually knocked their toenails off and sliced huge gashes into their feet and toes and not even known that they've done it because their feet are so numb. And these are the same people that with the proper therapy, we can restore normal sensation to the feet. I'm just here again to tell you that 96% of the time, neuropathy is treatable. Okay, it's fixable. The trick to treating it is figuring out what's causing the nervous system to break down in the first place. Okay, and that's the whole secret to treating neuropathy. Again, like I told you earlier, neuropathy is a problem with the breakdown in the nerves in the legs and feet predominantly. Something is causing those nerves to break down, and there's a list of things that can cause that to happen. And it's my job as a doctor, as a clinician, to figure out exactly what's going on to cause those nerves to break down. Once we find the cause of the breakdown of those nerves, we can fix that particular problem, and then we can start working on rehabilitating the nerves in the legs and feet to restore normal sensation, normal function, and restore some quality of life back to you. And that's exactly what we've done with patient after patient after patient that's been through our neuropathy treatment program. So if what I'm saying makes sense to you, I want to offer a DVD to you that I put together. It's very, very brief. It's only about 30 minutes, but it's jam-packed with information that's essential for you as a patient, or for you as a sufferer of peripheral neuropathy, that's going to give you the tools and the information that's going to allow you to get back to normal. Now, there's two ways that you can request the DVD. Number one, you can call our office. Our phone number here at the office is 813-933-6481. Again, it's 813-933-6481. It's all over the website. Call the office, speak to our staff. They'll get your information and they'll get a DVD packet out to you immediately. Now, the second way that you can request a DVD is to just simply fill out the form below this video. name, address, phone number. My staff will get that information and they'll send the packet out to you immediately. Now when you get that packet in the mail, I want you to open it up as quickly as possible, because in the DVD, after I explain the causes and the treatments and the success rates associated with neuropathy, I make an offer on that DVD, but the offer is time sensitive. So I don't want you to just put the DVD in a corner, say you'll get to it in a week or two when you get some more time, because you'll miss the opportunity to take advantage of the time sensitive offer on the DVD. So again, when you get it in the mail, take about a half hour. I promise it's not very long, about a half hour. Watch the video, watch it with your spouse, your significant other. Understand the concepts of what I'm talking about, and if it makes sense to you, then you can pursue a treatment program designed to get you back to normal. So again, there's two ways you can get the video. Either call the office or fill out the information blanks below this video and request a free copy of the informational DVD regarding your peripheral neuropathy. Again, I'm Dr. Marty Willmitch, and I'm here to tell you that there is hope. There is help for you available. You just have to be willing to make the initial step to get the information necessary so you can get back to normal. Again, I'm Dr. Marty Willmitch, and I want to thank you for watching this video.